you're a patient in the clinic, then you can call me Dr. Field or whatever it is. But I'm very happy to be here. I reached out to Josh, I think, in regards to, I saw a post. I'm involved with a lot of community projects. I actually graduated from Douglas High School over here back in 1998. I've done a lot of work with them since in the last few years. I taught classes for 2 years at Eagles Haven from when they first opened until I had my second child and got a little too busy and opened my second clinic. I was teaching acupuncture, art classes there, and meditation classes there for a couple of years. I go back to the school about 2-3 times a year to teach Tai Chi classes there as well. And I was speaking to Josh a little bit earlier, letting him know that I'm involved with the in Coconut Creek, the Food for the Poor. We have a big project we do with them out in Nicaragua. We built a whole village out there, and I'm always lecturing at different universities. I've lectured at Nova to the medical students over there, and at Barry University to trauma counselors, and whatever community stuff I could get involved in. I'm always happy to participate or volunteer wherever I can. So it's really cool to be in a group of like-minded people that are doing this kind of thing. I'm glad you rolled off some of my credentials there, so I don't have to blah 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 you guys to death. I want this to be interactive. I want to talk with you, not to you. I got a call from Josh right before that the laptop isn't here. I said great. Now I don't have to bore you guys to death. If I wanted to do that, we could have done this through Zoom. I'd rather just have a conversation anyway. So he told you all a little bit about what we do. I will tell you a little bit how I got started in the health field, and then I'll tell you a little bit about what we do now at the clinics and the kind of things that we see and we deal with. And then I'll take a couple questions from y'all because I think y'all might have some. So a little bit about me. Like you said, I've been in martial arts pretty much my whole life. I was born in Israel. I moved here at 7 years old. Been living in Coral Springs since 1988. So went to all the schools here locally. We're still back and forth to Israel a lot. All my family's over there except for my folks and my brother. Yeah, my brother's also a medical doctor. My mom's an occupational therapist. She's been in medical her whole life. My father was a medic in the Israeli army for a while. So that kind of introduced me to medical, but I was never a big fan of the way the system currently runs. As you all know, it's I think most of you all know, it's a little bit broken, and it's difficult if you're having chronic issues to get help. If you have an emergency, please, I want the jaws of life, I want to be airlifted, I want all the good stuff, but if you have any chronic conditions, it's a nightmare being in the medical system. So about 10, 11 years ago, well, I'll skip actually back a little before that. I got introduced into acupuncture and Eastern medicine through one of my martial arts teachers about 19 years ago. Every time I used to get injured training martial arts, and I've taught professional fighters and kids and all sorts of people, and every time I had an injury, acupuncture always worked very well for me for muscular skeletal stuff. And at about 31 years old, I think I got burnt out. I was working on a computer. I was working in digital media and art and design and graphic design, spending way too much time on a computer and spending probably 3-4 hours a day doing MMA training and that kind of stuff. It ended me up with a lot of injuries between the computer and all the training. I was overtraining and spending too much time sedentary position. I had tried some extreme diets and stuff like that, but I got to a place where I was at 31 years old. I was having hot flashes, chills, severe fatigue, depression, carpal tunnel, tendonitis, joint pain, systemic joint pain, every single joint, my whole body, knees, shoulders, hips. My back and neck were so bad I was disabled for a year. I couldn't work for a year basically. And I spent about a year just going from doctor to doctor to doctor. Some of you all may have experienced this or know somebody who may have. And after all of the doctors basically just tell me, oh, all your scans are fine. It's all in your head. Here's some muscle relaxers. Here's some pain pills. I was scheduled for carpal tunnel surgery 2 times, never did it. And I was just getting worse and worse and worse. So at 31, 32, I felt like something was wrong. It was almost not even really worth going on at that point. It was really, really bad. And finally, I got back with my acupuncturist. I met a guy that does functional medicine. He actually invents vitamins, and he's on the scientific advisory board for a bunch of nutraceutical manufacturers. And they put me back together. And within a few weeks of getting on these functional medicine programs, hot flashes, chills, fatigue, depression, completely gone. Then between chiropractic and acupuncture, changing some of my lifestyle habits and diet, even though I was eating pretty healthy, I tried to go vegan a couple times. That was terrible for my personal health. Might be great for somebody else. Wasn't good for me. And after about almost a year, I was 100% back to normal. So I knew two things. One, I couldn't go back to the same lifestyle that got me there because I had already hit the bottom, worst I could ever be, and I knew I needed a different lifestyle. Otherwise, I'd probably end up there again. Number two, I knew that I could do nothing else. I mean, I literally felt like I have a mission from God, or whatever, however you want to put it, is to help other people in similar situations that have been basically kicked around through the system. And usually in my age, or I'm 43 now, you don't see a lot of that, of young, healthy people in their 30s. They go through that. And as I've been in the field for a while, we see it now with people even much younger, kids, people in their 20s. So I wanted to help people. I went back to school, did a bachelor's, a master's, and then a doctorate, a whole bunch of different certifications. I have a clinic open for my own place now for 5 years on the border of Tamarack and Coral Springs. And we just opened up a place in Boca with my brother in Boca. He is a DO, he's a hospitalist, internal medicine. He's been working in hospitals for the last 10 years. Especially with the last kind of 2 years, he's a little burnt out of it, and kind of wants to go into private practice and help people outside of that whole medical system. So we're looking to get more into preventative care, chronic diseases, autoimmune stuff, chronic pain. Once again, if there is a medical emergency, please don't call me. 911, go to the hospital. When you're out, we can help you, and hopefully we can help people so they don't get there. So a little bit about what we do. I'll go through some of these services. We have a PA there that actually her whole career has been aesthetics too. So some of this skin stuff is not my repertoire. Like I don't really know too much about it, but we have a PA that's been in the industry for 16 years, just doing all that kind of stuff. So she's a professional. All the reps go to use her, and they do all sorts of skin tightening and microneedling and PRP stuff. Personally, my background is the functional medicine, which is basically going through with a patient, going through their everything from their lifestyle, their diet, their day-to-day, chemical exposures. We order a lot of like advanced laboratory testing that most doctors won't order or don't even know about or don't even acknowledge existence. And we look to try to find the root causes of problems. Right? Who feels like the doctors are always basically just trying to treat symptoms, right? I have a pain, this pills, surgery, which is great for some things, but not for other things, right? And they kind of keep you locked into that, and they make you feel like if you don't do what they say, you're screwed and it's going to go downhill fast. I've found from personal and professional experience that's not the case. There are options. Now, will this stuff work for everybody 100% of the time? Of course not. Neither do drugs, neither do surgeries, neither do anything else. But I would say probably 70 to 80% of the cases I deal with are successful to varying extents, and there are different factors affecting that, and I'll explain more of those in a minute. Other than that, I deal with anything from chronic pain, arthritis, herniated discs, carpal tunnel, autoimmune stuff, rheumatoid arthritis. GI issues is one of our specialties, and women's health is one of our big specialties. So like hormonal stuff, fertility, PCOS, endometriosis, that kind of stuff. My brother on his end, they do, and I might have him speak to you guys in the future and explain to you what he does with the peptides and the hormone therapy and his telehealth, and he does a couple other medical procedures, which I'll let him explain. But my background is the functional medicine, which is preventative wellness. We kind of look through all the testing, we go through the whole lifestyle, we make recommendations on diet, we make recommendations on nutrients based on your actual lab work, not just based on, oh, I heard this is good for you, or I read this online, based on science. It's all science-based. Most of the stuff we work with, this is all tons of medical journals and meta-analysis that have proved that a lot of this stuff works. It might be in early stages. It might not be something that a pharmaceutical company might not invest $1 billion into researching a vitamin because there's no money to be made, right? But there are clinical research to prove a lot of this stuff does work. And actually, if you look back at how all our pharmaceuticals are made, they're all, most of the time, made from plant extracts, from herbal extracts. So the other side of what I do is the acupuncture and Eastern medicine, the herbal medicine. 2,000 plus year history of success with that kind of stuff. I've had personal success with it. Ton of published research on it, everywhere from Harvard to UCLA to Johns Hopkins to MIT. They've all been doing research on it for the last 20, 30 years. Stanford, every major institution in the United States, their Ivy League school has a program for integrative medicine, and they're all studying and doing research on acupuncture, herbal medicine, meditation, all that kind of stuff. That is pretty much the gist of it. I don't want to keep lecturing you all, so let me get some feedback from you all. I'll see if anybody has any questions. Maybe I'll go around the table. And I will ask everybody for names like 3 times. I'm good in the clinic. Names is not my thing. I'm good with faces. Please.
Do you know my name is?
Josh.
Yeah.
Well, that's only because I've seen it like 18 times on Facebook, and you sent me like 100 emails.
And the witness protection.
So,
Yes, bingo.
You know about a phone neck with the kids.
100%.
So the
Huge.
question, you work a lot on that in joints, right? So
Correct.
do you ever see them come back with it? Like, do you try to get them to stay off of it, or do you tell them they don't listen? You know, how does the fix work? Is it both ends, or is it you? And they can go
It's
back?
a great question. It has not manifested into a pandemic yet with kids. There are kids that are having issues with it, but we actually see it a lot more in older adults. I actually had 2 new patients today. Yeah, you have people come in and they're spending all day on the computer or doing this and this. Usually 30s, 40s, 50s, 60s, and they have all sorts of, I had a patient today who was told she had spinal stenosis, was ready to have surgery. Her neck pain was basically 9 out of 10, 10 out of 10, had shots, tried medications, had tried physical therapy, nothing worked. I taught her some stretches, I taught her how to work on her posture, gave her acupuncture once a week for 2-3 months, no more pain, didn't see her for another year. Now she just had another bout, she's been working out too much. She comes in, I'm looking at her, she's sitting like this again. I said, Catherine, you could get all the cortisone injections you want, I can treat you 100 million times. If we don't correct your posture, you are never, ever, ever going to get better. And I tell patients straight up, like, the best thing I could have is for you to graduate and never come see me again. Because then you're going to send me referrals, rather than we need you to sign up. We don't push packages on people. There's none of that. I don't want people coming twice a week for the rest of their life. If that's the case, it's not working. That's not viable. I do treat kids of all ages, but we don't see a lot of them with the neck issues yet. In the future, that is going to be a big problem.
Yeah.
Not only neck, though, you're cutting off oxygen supply to the brain, and you're creating all sorts of other problems besides just the pain.
Yeah.
So it is a good question.
Now they're like 2. That's why I was thinking kids when I asked the question.
Yeah, and I typically, and I'll give you guys some good advice, if anybody's having those issues right now, what I tell my patients is instead of doing this all day, put your arms against your body and hold the phone like this. This way your arms don't get tired and you're not doing this. It makes a huge difference. That alone, just you put your arms against your body, you lean them like this, and you get used to it, and you just hold the phone right here, a lot better than doing this, right? And another tip, number 1 is you gotta watch your neck posture. Your spine is meant to be erect, right? If you're sitting like this all day, everybody's seen them. We all know the person that walks like this and can't turn their head. It starts off with a little bit, and it gets worse and worse and worse, and at some point you cannot correct that. So I can't stress enough, just be mindful of your posture. I've been working on this 20 years. I still practice in the mirror. You need to. Good question. Any other questions? Yes, sir.
I know.
Give me your name again.
Ernie.
Ernie.
A little bit about functional medicine. And I know that a lot of the blood tests and stuff, they're not covered by insurance. So what's the...
Some are, some aren't. It's true. Some are covered by insurance depending on who orders them. It really depends. We do take insurance for some of the labs. A lot of time, and that's actually a good question, because you go to a lot of these functional docs and right off the bat they're like, you need to spend $5,000 in lab work.
Right.
I'm the exact opposite of that. I would prefer most of the time you spend no money on lab work and we start treating you right away. Usually I'll ask people to bring in whatever labs they have. We have a pretty thorough intake. I actually have like 4 or 5 pages of forms you need to do. Then I typically spend half an hour to an hour with the patient and I ask them a whole bunch of questions. And I get a feel for them. I actually look at their tongue, I look at their eyelids. That tells me a little bit about what's going on internally. Based on clinical experience, based on case studies, based on our education, based on your existing labs, based on the questionnaires, usually that's enough to start treatment. If we're not making progress, then I might say, okay, you know what, we're kind of stuck. This should have worked, and it's not. There might be some kind of underlying something else going on. Let's see what other tests are available. I do not like having people come in and be like, wait, I need 10 grand in tests. A lot of times, one of the biggest problems in our medical system is unnecessary, wasteful spending on procedures and tests. I see that mostly with GI issues, right? Everybody's like, oh, I have constipation and the doctor, or reflux, and they put me on Prilosec or omeprazole for the rest of my life, and I did endoscopy, colonoscopy, and everything's fine, right? But what the doctors aren't telling you is that omeprazole, the Prilosec, all those antacids, they cause osteoporosis, they cause your bones to collapse basically in time, and this is all public knowledge. You can look it up on the FDA website or whatever it be. What they're not telling you is in time they'll shut down your kidneys. They're also, you need acid to digest your food. If you don't have hydrochloric acid and digestive enzymes, what's going to happen is all the food you do eat is going to putrefy and rot inside of you and then cause other problems besides just the reflux. I'm sorry to get gross while everybody's eating, but that's what happens. Very good question. So yeah, we're kind of the opposite of that. It is how most of the functional docs go. I was trained by one of my mentors who's very conservative with the nutrients we use and the lab testing. Like, hey, see if you can figure out the problem first before you waste people's time and money just running around doing this kind of stuff. And a lot of times people come to me and they've already seen 2 or 3 different functional docs and 4 different GIs and an endocrinologist and 9 specialists, and they're like, you're our last hope. We heard you were good. Your reviews are off the chart. Please help me. And a lot of times we will be able to help those kinds of people. But good question. Ernie, right? Yeah. Ernie, Josh.
Nice.
Who's next? Any other questions? Go ahead.
No, I was waving to Dennis and to...
Hi, Dennis.
You just bought a $5 million car. And see what happens when you're going.
Good question. Sounds really cool. It's like the Matrix times 2, times 8. It's what the Kardashians use to get their face done. It's a microneedling device. It's a microneedling is it's like acupuncture. It's like an electric toothbrush or like a tattoo gun that has like 15 like little acupuncture needles, and it just goes really fast and pokes a bunch of holes, and it creates more collagen and tightens the skin and helps with lines and wrinkles, and it just rejuvenates the skin. It's actually FDA cleared for treating acne scars and rosacea and a couple other different things. So the difference between that and a regular microneedling, like the skin pen, is microneedling plus has radio frequency. So the radio frequency is it's basically heat therapy that gets in under the skin and actually causes even more regeneration of new healthy red blood cells and collagen, and makes the skin more elastic and looks much younger. You're actually, at your age, you're actually not a good candidate for Morpheus. If you want to do like, you don't need it anyway, but if you want to do like regular microneedling.
He's actually 40.
I wasn't going to say it, but.
Love you. I did PRP, if that means anything.
You've done PRP? What kind of PRP?
Indeed.
The knees. So I do PRP injections. I actually did my stem cell and PRP training with Parita up in Boca, who does the Dolphins and did LeBron James. He's one of the top docs out here. You guys know Parita?
No, I know what it is though.
Oh, okay. So anyways, he's one of the top docs in the country. He's been doing stem cells for about 17 years. He was an orthopedic for 40 years. So he was the first person who actually certified me in the stem cells and PRP therapies. Is everybody familiar with what PRP therapy is?
I have the pictures of the needles.
Okay, so it's pretty interesting. It actually works along the same methods as acupuncture and these different therapies, but what they do is they draw your blood, and then we put it in a centrifuge and we spin it. And we separate the red blood cells and the white blood cells, and we take the platelets, which have the strongest amount of healing factors and cytokines and growth factors, and a little bit of plasma. And then I have a special process. We actually put it in a photonic light generator. Then it activates the stem cells even more, and then we'll inject it back into a joint or a tendon where you have maybe mild to moderate tendinitis or mild to moderate arthritis or muscular or fascial pain. If you have severe bone-on-bone osteoarthritis, it won't work. At that point, you might need like a full stem cell procedure or a joint replacement. At that point, acupuncture and PRP may give you some temporary relief, but if there's no cartilage on, once you start rubbing up again, that inflammation's coming back. You're going to need to do something kind of bigger about it. But they use the PRP for joints and for pain. We also use it in the facial procedures and for hair restoration. So what we do is we take the PRP out and you inject it around any bald areas, and then we microneedle over it because that gets a lot of blood flow and increases the circulation in the area. And then we take PRP with a brush and we kind of post it over there, basically brush it over the head again to soak into the skin. So that rejuvenates the skin. It can help hair growth and it helps for the face. People use it for the skin on the hands and all sorts of other stuff. My training is mostly for joints and for orthopedic type of procedures.
What's the success rate on something like that?
So before we'll take a patient on for that, for which part of it? For the joints or for the hair? Or
joints.
For the joints, I'd say with the patients I've been seeing, probably about 70%. If it's a really bad case, and if I know it's osteoarthritis, or if I know they have a bone spur, or if I know, I prefer to have an MRI first. I've done it without MRIs, but I like to see the MRI to see what the orthopedic said and what the radiologist said, so we know what we're treating. If it is a case where I don't think it'll be successful, I won't take the patient. So that way I have a higher success rate, because I don't want to waste my time or your money if I know it's not going to work, basically. But it is pretty successful. Will it reverse your arthritis for the rest of your life? No. But if it buys you a few years, and often it will. I have a guy that I work with, he's early 50s, was limping for months. I mean, probably 3-4 months. He did a PRP procedure for him. Within about 2 weeks, no more limping.
What about for meniscus type issues?
Depends on the grade of the tear. If it is completely severed, no, forget about it. You would need to basically get that surgically repaired. If you had a mild or moderate tear, it can help, and we usually would couple that with acupuncture. We also do different homeopathic injections sometimes too, like you're familiar with arnica? No, it's a homeopathic. I mean, they sell it at Whole Foods. They sell it everywhere. Sometimes we'll even mix that and B12 and inject it into joints or areas because it helps with inflammation and red blood cell repair. On a case like that, sometimes you might need to do like a treatment of PRP. You might need to do like maybe 2 or 3 shots in a row. Like you do one like every 4 to 6 weeks for like 2 or 3 times. And sometimes you do one and it's like a miracle. And when you're doing the PRP, it can actually take up to 8 months to get the full benefits of the procedure. Sometimes you see results immediately, sometimes it takes a few weeks, sometimes it takes longer. It varies from patient to patient. The healthier you are, the better quality platelets you're going to have as well. And oftentimes you can actually see it when you spin the blood. You can see the quality of the blood and that kind of stuff. But very good question. It's unethical to take on a patient you know it's not going to work for them. So we try to avoid that as much as possible. And sometimes we'll even inject the area with some, it's like a road test. We might inject you with some lidocaine or something first. If the lidocaine numbs it and actually gives you some pain relief, then there's a good chance that the PRP may work for you. If the lidocaine doesn't do anything and there is basically a structural problem, then we know the PRP is not going to help you. That's something you would probably need to consider something surgical or something different. And I also recommend, depending on the patient, we teach a lot of exercises to patients. I send out to physiotherapy, I send out to chiropractic, depending, case by case basis. There's no one size fits all. Part of the problem with our medical system, you come in, I have this, doc says, okay, you get this. And they don't know anything about you. They don't know your prior medical history half the time. They don't know what else you're taking. They don't care. You have this, you get this. It's just they treat the symptoms, which it doesn't work a lot of the time. Any other questions? Any comments, feedback on the talk? Very good. Very good? Yes, sir. And it was Daniel? Okay. Herniated disc. Excellent question. Controversial subject. Backs are complicated. One is probably the #1 most well-known thing that acupuncture is successful for. And there's a ton of medical research to support it. Medicare actually just started covering acupuncture for lower back pain. A lot of the insurance companies do cover it because there is so much clinical data showing that it does work. Herniated discs can heal. They can go from a herniation to bulge, and bulges can disappear. Now, a herniated disc, though, is not always the cause of the pain. They've done a few large-scale studies where they took, let's say, 1,000 people that had herniated discs and MRI'd them, and they had herniations and bulges. In numerous studies, about 50% of those people have zero pain. So just because you have a herniated disc doesn't mean that's the cause of your pain. It also doesn't mean it's not the cause of your pain. But we can't work with that. If you have spinal stenosis, a lot more tricky. That's maybe. Herniated disc, we get very good results with most of the time. There are other factors involved, and we will teach stretches and exercises. Nutrition, hydration is important. All that stuff is actually crucial to recovery. If you don't have the building blocks to recover, it doesn't matter how many times I treat you, you're not going to get any better. That being said, I have patients 97 years old, and their back pain gets better. So it's always possible. And that's one of the other problems I have with the medical community. A lot of times they're like, oh, there's nothing you can do about it, which is BS, right? That's based on statistics. Every person's an individual. You never know who's going to be that miracle. And in my experience with back pain, herniated disc, probably 80% success rate between the acupuncture and the other, to different degrees. It's not always going to be 100%, but most of the time, 80% of the patients are very happy and get significant reduction in the pain. I usually tell people, depending on the severity of the pain and the length of it, I usually tell them it might take about 10 to 12 sessions. Sometimes you do 1 or 2, and it's a miracle, and I say, good, you're done, don't come back. Right? Sometimes it takes a little longer. We have to see how your body responds to the treatment, and everybody responds a little differently. But great question. Yes, sir.
Did you say you were an MD?
I am not an MD. I have a doctorate and a master's, a clinical doctorate and a master's in acupuncture and Eastern medicine. I have a bachelor's in health sciences, and I am a primary care provider in Florida, but I'm not a medical.
Okay.
They're different.
And what worked for you? You said that you were going through it in your early 30s.
So
I may have missed that.
Yeah. Good question. It was a combination of different stuff. Okay, I had to change my diet. I had to change my workout, my workout routines. I was overtraining. Acupuncture helped me tremendously, and specific nutrients and vitamins based on the blood work that I did was, I think, really kind of set me up to be able to heal. And I was doing chiropractic as well. So it was a combination of all those things, and I don't discount any other therapy, and I'm not the guy to be like, don't listen to your doctor, we're going to fix all your problems, because that's, and actually my other practice is called integrative medicine, because we work with everybody. We want what's best for the patient, and we try to treat everybody how we would treat my mom or my wife, or maybe better, because we don't always listen to our family members. But yeah, there isn't, sometimes you get lucky, and it was very nice to meet you. It was, Craig? Take care. Have a great trip. Or what are you doing? It's a good question, but it varies from patient to patient. Every now and then we will get a case, and it's like just acupuncture, or just literally like, sometimes it can be as simple as like one vitamin or one change of diet, like don't drink ice water with your meals and problems. Yeah, like little things like that. I'll give you a tidbit, and then I'll wrap up, unless anybody has any other questions. Perfect. So since I just brought that up, cold drinks with your meals, this is the only country in the world that does that. Okay, and it is horrific for your health, and if you have any digestive issues, that is the first thing you should cut. You should actually drink very little fluids with your meals. Most of your fluids should be probably half an hour before your meal or 45 minutes an hour later. I'm not saying don't drink with your meal, by all means. Rinse your palate, cleanse your mouth, don't choke on your food. But trick question, who knows what in your stomach actually digests the food? Acid. What happens if I put a bunch of food in and then I dilute all the acid? Acid doesn't work, all right? And then all the food is sloshing around, and then what happens if I take a full cup of water, like this one right here, and I put 20 ice cubes in there? Overflows. All the acid comes up, okay? Furthermore, cold is even worse, because cold makes things shrink. Cold is a vasoconstrictor. When you eat a big meal, when you get tired after, it's because 70% of the blood flow is leaving your brain and going to your stomach to digest your food. That's why you're tired after a big meal. If you drink a whole bunch of cold water, not only are you diluting your stomach acid, and not only is the cold going to condense and shrink and harden all the food that's in there and make it hard to digest, you're also going to shrink all the blood vessels, all the arteries that are supplying your stomach and your digestive system with the blood supply. So it's going to make it very difficult for you to digest your food. So, and if you don't have digestive issues or other issues, I wouldn't worry about it. So if you drink beer in Europe, it's not ice cold, right? It might be cool, or it might be kind of room temp. This is the only place. If you drink in China, if you're not drinking tea with a meal, some places will serve you boiling water because that will actually improve your digestion. It's a vasodilator. It'll bring more circulation to the blood flow. But once again, if you don't have digestive issues, I wouldn't worry about it at all. There's nothing, and once again, it's not a one size fits all. If you have an issue, that's one thing we might take into consideration. If you don't have any issues, have at it. God bless you all. But thank you very much for your time. If you do have any more questions, I'm here. I'll leave some cards, and I brought some a little flyer that actually has a promo for some specials we're running. But we also do free consultations in the clinic and via Zoom. So if anybody has any questions, or if you have a family member or a friend or anybody that has any sort of chronic health issues that's not getting resolved from the doctors or any chronic pain, we'll see them for free, we'll talk to them, we'll tell them, and if they're not a good candidate, we'll tell them, sorry, I can't help you, continue what you're doing, or we'll refer them out. But if we can't help them, we're happy to, like I said, speak to them. We'll take 10, 15 minutes. We'll find out what their medical history is, and we'll tell them, hey, this might be good for you, this might not. We're always happy to do that. All right? Thank you. We're wrapping it up. Thank you.